And joining us now, Dr. Ashish Jha, Dean of Brown University's School of Public Health. Hi, Doctor. Good morning.
Good morning, Savannah. Thanks for having me back.
There's a lot that's new in this plan. To me, the big ticket item is this requirement that private sector businesses with more than 100 employees have to mandate that the employees have the vaccine. How big an impact could this make?
Yeah, I think it can make a really big impact because the virus is not going away. So this is not what do they need to do over the next few weeks. It's how do we get our society back? How do we get workers back? And how do we do it safely? And I personally can't think of how you bring people back into indoor offices safely unless you actually require that people be vaccinated or you're doing regular testing. So from a pure worker safety point of view, this makes a lot of sense.
The rule, by the way, just so I'm clarifying here, either you have to be vaccinated or face weekly testing. That's for the private sector. Just a larger picture question here. Needless to say, those who are vaccine hesitant on political grounds are unlikely to be persuaded by this. Was this the right move for the Biden administration to essentially give up on persuasion and go to mandates?
Yeah, no, it's a really good question. And it's obviously the persuasion has been difficult because there's so much misinformation about these vaccines. You know, the experience of mandates so far has been that people basically get vaccinated. That's what we're seeing in hospitals, as we're seeing at the university where I work. We have a mandate and 99% of people have gotten vaccinated. So I know that there is a lot of resistance, but my sense is the data so far suggests that when you put the mandate in, people do go ahead and get the shot.
The flip side of this is there are critics of the Biden administration who say, what took you so long? Why? You should have done this months ago. Was there premature celebration last spring when, hey, the mask can come off. If you're vaccinated, go have a party?
Well, I'd say two things. I mean, first of all, I do think persuasion is worth trying, and I applaud the administration for trying that first. I think if they had gone to mandates in April, May, that would have provoked a lot more backlash, and I think rightly so. You know, in terms of whether they celebrated too early, my take is the Delta variant wasn't with us. The Delta variant has really been a game changer. I don't think any of us saw it coming and none of us saw that it was going to be quite as bad as it is. So I think that is really what has set us back.
Let's talk about schools for a moment. There's a new rule now that schools have to have their educators be vaccinated. But and the big question here, of course, is the kids under 12. They don't have the option to be vaccinated. Where do you see that going? How quickly might we see approval from the FDA, at least on an emergency basis?
Yeah, so there are two things there. I think what we know is that kids under 12 largely get infected from the adults around them. So if you want to protect your kids, or kids under 12, you should be getting vaccinated. And if we have highly vaccinated communities, kids under 12 will be okay. But they do need to get the vaccine. And I expect probably in about a month, maybe sooner, for the companies to share data with the FDA. And my guess is sometime in late October, maybe early November, we're going to start getting shots into arms of kids under 12.
All right, Dr. Jha, always good to see you. Thank you very much.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.